It's Cushing's disease day. And before we talk about Harvey Cushing, whose name we honor even today because he discovered the disease, we have to explain what Cushing's is. It's a state of having a high cortisol level, which can have several etiologies. It can come from the pituitary gland, a tumor on the pituitary gland, a tumor on the adrenal gland, or a tumor outside the adrenal or the pituitary, usually in the chest. Going back to 1800s, people knew that there was something wrong with these patients. They were very overweight. They had a very round face, like a moon face. A lot of them had diabetes. And in those days, diabetes was checked by basically testing the urine because there was no blood test or anything. They are very lucky today. They knew that there was a problem because some of these patients actually went psychotic. They became mad. And some of the Cushing's patients were found actually in asylums, in all these houses where the psychotic patients were kept. Just as a side note, also in the past, in the 1800s, some patients who had a very high thyroid level became psychotic, and they were thought to be mad, and they were placed in these horrible houses. But anyway, Harvey Cushing was a prominent surgeon in Boston at Harvard. And he took this very seriously. He said there must be something wrong, and where is this wrong happening? And he kept these patients for weeks and months in the hospital doing test after test after test. You have to understand this is 1912, and we didn't have the sophisticated laboratory techniques we have today. So he postulated that the majority of the cases are caused by a pituitary tumor that will influence the adrenal glands. Remember, the pituitary is a queen mother gland of all glands and controls the thyroid and the adrenal glands and the ovaries and the testicles. And he actually performed the first surgery in these patients. It was done through a craniotomy. He opened actually the skull to take the tumor out. Nowadays, we have sophisticated methods by which we go through the nose, and this is an old method that was used by the Egyptians, believe it or not, and that's how we operate on pituitary tumors. So this was Harvey Cushing, who basically opened this beautiful area of research in high cortisol states. Now, even today, making the diagnosis of Cushing's disease or Cushing syndrome is very difficult because you have to first identify the patient clinically. Well, who are these patients clinically? These are patients with rapid weight gain. They have, many times they have diabetes, they have high blood pressure, they have a very round face, they have supraclavicular fat, and they have a posterior cervical problem, which was called, unfortunately, in a very bad way, a buffalo hump, but it's actually a cervical fat pad. So the acumen of the physician from a clinical point of view has to trigger an investigation for Cushing's, for a high cortisol state. And it's done by measuring free cortisol in the urine and in the saliva, and then you have to prove where this high cortisol is coming from by doing ACTH, which is the hormone coming from the pituitary gland. You have to do dexamethasone suppression test, so it's a very, very difficult workup in order to make the precise diagnosis, because you don't want to confuse whether the etiology is coming from the pituitary or from the adrenal or from an ectopic source in the lung and in other parts of the body. So these investigations have to be done by an endocrinologist. It's very, very difficult for a primary care doctor to have the expertise to do this. And some other time we'll talk about the exact way to make the diagnosis and how to do the treatment. So this is about Cushing and Harvey Cushing, and we are all very grateful to him for identifying the disease. And next time I will talk to you about non-Cushing states, which are now recently have been described in the literature, and what to our patients, because it's a completely different